Welcome to the AQA YouTube channel. To navigate through the video, you can select specific chapters or subjects of the video. Enjoy watching and remember to subscribe.
Good afternoon, everyone. Thank you for joining us today. Today we are joined by Kirsty McRae, who is an accredited exercise physiologist at STEPS Neurological Therapy Services, I should say. Kirsty's had a lot of experience in her role, from Royal Talbot to where she is now, but I'm sure she can explain to you what she's done. So I hope you all enjoy this session. She's got a lot of experience with people with spinal cord injuries, so I'm sure you will all be interested. Okay, thank you, Kirsty, all yours.
Thank you, Georgina. Yeah, like both Naz and Georgina said, I've had the pleasure of working with spinal cord injured persons since 2009. So I have had several years experience working in Talbot, where I got to work with people with newly acquired spinal cord injuries. And the last 6 years I've been working at STEPS, where I've got to work with people across the lifespan, which I'm sure many of you that have had your injury know that the needs across the lifespan are changing and quite different than what you're needing in that inpatient rehab. I'm going to try to cover across that span as best as possible today in terms of exercise recommendations. Obviously, exercise can look very different for lots of different people, what your needs are. So we'll keep it fairly broad in terms of recommendations, but I'm more than happy to field questions that you might have as well. So I'm just going to bear with me with technology, try to share my screen and bring up a presentation. Now, can we all see that? Yeah, I've got a thumbs up. Excellent. So one of the first things that I'm going to talk to is what's an exercise physiologist. And I have to say is when I studied exercise physiology, I didn't realize how commonly I would be fielding this question of what exactly do I do? So an exercise physiologist is a university qualified allied health professional. They've done a minimum of 4 years university. Most of us have done 5. We've got specialized knowledge in exercise interventions for people with acute, subacute or chronic medical conditions, injuries or disabilities. So one of the questions we often get is what's the difference between a personal trainer and an exercise physiologist? And I would say a really big HECS debt. And the fact is that personal trainers are skilled in working with healthy populations. So they've done a shorter course, about a 3-month to a 12-month course, and they understand how to provide exercise to healthy populations that don't have any medical conditions and don't have any injuries. So the 4 years of uni has been so that we can learn how to work with different populations with different medical needs and different injury needs. As I mentioned, that can be across the lifespan. So whether it's from a rehabilitation phase or improving health and weight management across the life. You might work with them in hospitals, private practices, or even in a community gym setting. We are recognised as per other allied health professionals by NDIS, Medicare, DVA, TAC, work cover, and most of the private health insurers, depending on what your level of cover is. So what does my role entail? It can be very varied from day to day, from dealing with early rehabilitation where we're maximising your functional capacity, working on injury management or injury prevention, strength and conditioning and cardiovascular training programs, giving lifestyle and health education, weight management programs, supporting community integration, so whether that be into a community gym setting or a community pool, returning to sport or recreational exercise, finding whatever it is that breaks down those barriers to participation in exercise for you. Hydrotherapy and return to swimming and water safety training, and also a bit of a niche one is manual wheelchair skills training. Tends to be one that's not actually covered for any allied health professional during uni, but due to my fortunate experience that I've had many years of wheelchair skills training practice. The other common question that we're fielding is, how is exercise physiology different to physiotherapy? And one of the reasons is many people wonder why they might have both on their team. And we do work quite collaboratively in a multidisciplinary team. So on the left-hand side, we've got what you might see in exercise physiologists for. So again, we're mainly prescribing exercise education in terms of how to safely exercise to manage your condition, to minimize your risk of injuries, and to maximize your functional capacity or rehabilitation. What an exercise physiology does not do is we do not do any acute or hands-on therapy. So we won't do any massaging or dry needling. That is purely a physiotherapy skill set. So on the right-hand side there, we've got the list of things that you might see a physio for that you won't see an EP for. So if you've got an acute onset of pain or injury that is a new pain, if you need a prescription of a gait or mobility aid, management of tone or spasticity, respiratory management, or vestibular management. So that's something that you would go to a physiotherapist for. There are obviously some overlaps between the two. So you can see that exercise is in both of those things, but in terms of exercise prescription for managing your condition, that's kind of our bread and butter. So I just thought we might, and if anyone wants to put in their two bobs worth, feel free to take yourself off mute for a second. Getting to know you or just giving you a second to think about what you want to get out of today's presentation. So I'm hoping that we might increase your knowledge and confidence to participate in exercise that will help manage your condition and your general health. So if we can get a thought on what's your current confidence level? So on a scale of 1 to 10, where do you sit right now in terms of, do you know what you should be doing? How confident are you that you know the exercise you should be doing to manage your health? So if anyone wants to
I'll put my hand up, Kirsty.
How confident do you feel, Georgina?
I'd say probably 9 to 10, and I've got a reason why I can say that, because Kirsty, you're my exercise physiologist. And so I see Kirsty currently via telehealth because of COVID restrictions on a weekly basis, and it's amazing how that is possible, and it does help me having some equipment at home as well. So I'm pretty confident, but I still got a lot to learn as well. We've got
a few come through in the chat. So we've got some 4 and a 5, got some 8s, which are great. So that's a pretty high confidence level there.
Yes.
So hopefully for those, not too much new information today. So then the next question is, especially for those people with high confidence that they know what they should be doing, what is your current participation level? So again, from 1 to 10, how close are you to matching those? Are you currently doing what you can be doing to manage your general health? So 10, that we're confident we're doing everything we should be doing. 1, we know we're not doing what we should be doing. Does anyone want to volunteer themselves there? We got a 5. 2, we got a 2. That's very honest.
Very cool.
Yeah.
It's like a big variation, Kirsty, there.
Really big variation. And I think what hopefully we can do today is get everyone confident enough that next week, if I asked you the same questions, we'd see a slightly higher number. So maybe even write those numbers down, and in 5 days' time, ask yourself again and see if we can increase those numbers a little bit. If I can move them by 1, I'll be super chuffed with myself. So the next thing is why are we exercising? And I think this is a really important to ask yourself before you engage on a new exercise program, because having importance and having value to yourself is the only way it's going to stick. It's the only way that you're going to actually stick to the plan that you want to do, is if you know why. Now, this little infographic there has been, 8,500 people asked, and these are the percentages of what people answered. I was actually a little bit shocked. 33% exercise to lose weight. But I think, like I said, exercise can look different to everyone, depending where you are in either your rehab or life journey, for want of a better word. The type of exercise you choose to do might be different. So there's no one size fits all. But I think it's really important when you're looking at embarking on a new exercise program to really understand what's your motivation to exercise. So this is another tool I like to work with for people who are about to start exercise, and understanding the barriers to exercise. There are a lot. There are what we call real barriers in terms of cost, time, those sort of things in terms of accessibility to facilities or equipment. And then there's perceived barriers, which some people might call excuses. So we want to try to break down as many of those barriers as we can. And so we want to go through these. And again, I'll give you a minute to work through. If we look at those scores, so for each question, we're going to choose a number between 1 and 4. 1 being never true, working up to 4 being always true. So if we think of number 1, how confident are you that you can overcome barriers and challenges with regard to physical activity and exercise if you try hard enough? Do you feel like that is always true? You can always overcome those barriers and be active if you want to? Or do you find that that's never true, and if there's a barrier, that's your participation done for the day? So see if we can get a bit of a score. So obviously we're going for 10. The maximum score, full confidence, would be 40. The lowest score would be 10. So how confident are you that you can find a way to be physically active, that you can accomplish physical activity and exercise goals that you set? How confident are you that when you're confronted with a barrier to physical activity or exercise, you can find a solution to overcome the barrier? How confident are you that you can be physically active or exercise even when you feel tired? How confident are you that you can be physically active or exercise when you feel depressed? How confident are you that you can be physically active or exercise even without the support of family or friends? How confident are you that you can be physically active or exercise without the help of a therapist or trainer? How confident are you that you can motivate yourself to be physically active or exercise after I've stopped for a while? And after lockdown, that might be a lot of us. How confident are you that you can be physically active or exercise even if I've had no access to a gym, exercise, training, or rehab facility? So hopefully, as you've thought through those questions, it might have brought up some barriers in your head. You might have thought of, well, actually, no, when this happens, I don't feel like I can. Things like if you feel tired or fatigued, or things if your mood is a bit low, you find it challenging. We can chat about that as we go. And if you want to bring them up in questions later, we can talk about them more specifically. All right, so now that hopefully we've got a bit of a baseline of where you are with exercise personally, we're going to go through what the benefits of exercise are, and they are many. So we've got some generic ones that are across all populations. So that boosts memory, aids weight loss, prevents illness, helps quit smoking, improves depression and anxiety, improves strength, increases longevity of life, reduce risk of falls, reduce risks of heart disease. And then we've got some that are a little bit more specific to the spinal cord injured population. So increasing muscular strength and flexibility, decreasing the risk of shoulder pain and overuse injuries. And anyone that's worked with me will know that I harp on about shoulders quite a lot, and I will continue to do so in this presentation. Decreased risk of depression, improved quality of life, improved functional independence, increased cardiorespiratory health and fitness, improved respiratory function, decreased incidence of upper respiratory infections, improved immune function, and decreased risk of cardiometabolic disease. So that's obesity and diabetes is kind of what we mean when we're talking cardiometabolic. In terms of the health considerations for spinal cord injury, often what we see is that persons with spinal cord injury have a decreased exercise capacity, and there's an altered cardiovascular response, so an altered heart function. And so this does sometimes make it difficult to monitor intensity for exercise because you won't see the same heart rate response to being active. So all those sort of age predicted heart rate zones don't apply to a lot of people with a complete spinal cord injury. Increased or changed workload on certain muscle groups. So again, increased risk of overuse injuries, especially the shoulders. Increased sedentary time. The opportunity for incidental activity is considerably lower if you're using a mobility device such as a wheelchair. Increased risk of weight gain, increased risk of cardiovascular disease and other cardiometabolic diseases, and an increased risk of respiratory illness. So as you can see, the increased health factors associated with having a spinal cord injury are quite considerable. And the good thing is, with all of them, the most common way to minimize your risk is by being active. I just wanted to touch base before we get too deep into the difference between physical activity and exercise. So a lot of people talk about being physically active. Physical activity is sporadic or unplanned movement. So it's kind of your day-to-day movement. You're going, you know, they say park further away and push or walk further. That is physical activity, but isn't exercise, and the health benefits are different. So while physical activity is good, and I encourage you to be as physically active in your day, exercise is where the biggest health benefits are. And exercise is planned and structured and intentional. It follows guidelines and recommendations that are intended to improve your health and fitness. And this can be participating in sport, doing a structured strengthening program, going for a walk or a push, but it's planned, it's deliberate, and it follows those recommendations that we're about to go through. So I've just told you how wonderful exercise is. So exercise is medicine is a really, you know, big tagline going around at the moment, but what's the right dose for you? So these are the physical activity guidelines that have come out of Canada for spinal cord injury. So the one thing I really like about them is they've put a starting level and an advanced level. So rather than it being expected that everybody does the same thing, the starting level is kind of the minimum that we would be working with to achieve health benefits. And then once you're able to tolerate that, then we would be working up to the advanced level. And we do see increased health benefits with increased participation. So doing one is better than doing the other. So it's really simple, 20 minutes of aerobic activity 2 times a week of a moderate to vigorous intensity, and 3 sets of 10 repetitions for strengthening exercise twice a week for each major muscle group that has voluntary control. So obviously for spinal cord injury, anyone that has different injury levels, that program's going to look different for you. And then when we're going up into that advanced level, it's really about increasing the aerobic activity to 30 minutes. And again, these are minimums. These are what we're sort of making achievable recommendations. So to do more than that, excellent. There's no harm done, as long as you're pacing yourself and not going into fatigue. Now, with all the words that we're going to talk at you, this is the easier way I like to put exercise recommendations in. So we use the FIT principle. So we use F for frequency, how many times you're going to do it per week. I for intensity, how hard are you going to exercise. T for time, how long are you going to do it for. And T for type, what kind of exercise are we going to do. So I'm going to break it all right down into our FIT principle. So in terms of aerobic exercise, it's characterized as continuous repetitive movements that are aimed to elevate your heart rate and your breathing rate. So really it's your huffing and puffing exercise.
20 minutes twice a week.
20 minutes twice a week, exactly, as a starting point. And it's targeted to improve your cardiovascular system, and the right dosage can reduce your risk of heart attack, high blood pressure, high cholesterol, stroke, and arrhythmias. It's also been shown to have really good benefits for mental health and cognitive function, improving sort of memory and alertness, as well as improving endurance and improving mobility. So in terms of how to measure intensity, so I spoke about that altered heart rate response. So wearing a heart rate monitor can be good if you understand what the heart rate means to you. Everyone here is going to have a different heart rate range, depending on what your injury level is, what medications you're taking, and what your fitness level is. So I'm not going to give ranges, that's not helpful for anyone. But we use a few tools, one being the rate of perceived exertion. So this is how hard you feel like you're working. So when we're talking the recommendations for moderate to hard activity, we're sort of working in that 5, 6, 7 area there. So if you read the descriptions, you're moderately sweating, but you're able to speak. So that's when we got the talk test on the other side. If you are gasping for air and you can't maintain any conversation, if you can't talk in short sentences, then you're probably going too hard and you need to rein that intensity back in a little bit. Again, you can, some people do like the heart rate monitors. You can do that once you understand what heart rate you're looking for and what that represents for you. Does anyone have any questions around that while we're on this slide? No, all good? So putting it into the FIT principle here. So 2 to 3 times a week, moderate to high intensity, 20 to 30 minutes. Now for cardiovascular exercises, there's 2 that fit into the T, the type. We can do mode of exercise, so arm bike, swimming, walking, wheelchair propulsion, participating in sports, cycling, boxing. There's a million different things, as long as you're getting yourself huffing and puffing. One of the considerations I like to think about though is what benefit or harm the activity might do to you. So wheelchair propulsion, if that's your main mode of mobility, doing it more for exercise can increase your risk of overuse injuries because you're repeating the same motor pattern again and again and again. So sometimes it might be nice to maybe do an arm bike or go cycling outside, swimming, something that encourages the shoulder to move in a different way, but we're still achieving the cardiovascular response that we want. And the other type would be whether we're going to do low intensity steady state exercise. So that's where we are just maintaining that moderate intensity consistently for the 20 or 30 minutes, or if we're going to do high intensity interval training. Both have really good benefits in terms of your health, slightly different benefits. Low intensity steady state is really good for improving cardiorespiratory function, so the function of your heart and your lungs. High intensity interval training is really good for weight loss. So there's benefits for both. High intensity interval training can give you good bang for your buck if you don't have much time. But I think doing a combination of the two is a really nice way to look at it if you are used to exercising at a higher intensity. If you have not been active for a little while, I would not suggest starting with high intensity interval training. I would work up to that. And we've got our strengthening and resistance training. So again, different ways of looking at this. It can be weightlifting, it can be dumbbells, it can be TheraBand. I know that TheraBand is often not very popular, but it really does do the job. Machine weights, it's a repetitive loading aiming to increase muscle size and strength. So its benefits are to maintain strength for day-to-day activities, increase muscle mass, which does in turn improve your metabolic rate, which helps with long-term management of weight, reduce risk of injuries, improve posture, and maintain your functional independence, essentially. So putting that into the FIT principle, we can do at least twice a week, moderate to high intensity. Now, intensity for strength training is obviously a little bit different. We'd measure it in terms of maximum of repetitions. So we would be aiming, if you're doing 10 repetitions of each, by the 9th and 10th repetition, it should start to feel challenging. If you are doing 10 repetitions and it's easy, you probably could be strengthening a little bit more efficiently if you go up in weight. If you can do 20 or 30 of the same movement, you definitely are doing it a little bit too easy. We would do 3 sets of exercise for each major functioning muscle group. And again, we can look at weights, TheraBands, body weight exercises, or Pilates. This is where my nagging starts. So shoulder health in spinal cord injury is really, really, really important. The shoulders have, you know, for most spinal cord injured clients have become a really important joint. It's not designed to be a weight-bearing joint, but after an injury, they have to do transfers, wheelchair propulsion. Even if you're ambulant and you're using gait aids, you're weight-bearing through crutches or walking frames, and it really does change the demand on those muscles. So in that picture up there of the shoulder joint, now that's looking at the shoulder from the front. You can see the pecs coming up on the diagonal and attaching at the front there. And across the top, you can see there's a flat bone, that's your collarbone, and the little hood is your acromion. Underneath there, you can see that space where those tendons are running. What we see, and lots of people have probably heard of impingement syndromes, supraspinatus tears, they're the most common overuse syndromes that we see in spinal cord injured shoulders. So research has shown 30 to 70% of persons with a spinal cord injury experience shoulder pain. Like, that's a huge percentage. And the incidence and the severity of shoulder pain tend to increase with time since injury. So prevention really is the best strategy. If you don't have shoulder pain, brilliant. Still go and do the exercises, because that's how we're going to control the risk to your shoulders in the future. Chronic impingement syndrome, such as rotator cuff tears, are the most common cause of shoulder pain. And without intervention, shoulder pain after spinal cord injury is associated with losses in function, losses in community mobility, and a decreased quality of life. So it's a really, really important thing to be ahead of. When we start playing catch-ups, you know, with shoulder pain, it can be really challenging because it's difficult to rest the shoulder if you're reliant on your upper limbs for mobility. In terms of what we're looking at now, if you're only going to do a few exercises, these are the key muscles that I would be focusing on. So what we tend to do is focus on the muscles that balance you out. We do a lot of work during the day in pushing forwards, which uses our pecs and biceps and deltoids. And we do a lot of transferring and lifting using those same muscle groups. The way that we tend to, myself included, sit is with our chest sort of forward and rounded and shortening those muscles. So what we want to do is strengthen the posterior chain, or the muscles on your back, that will balance you out and open up that joint space to minimize the risk of injuries. So these are the main muscle groups. So we've got your shoulder depressors. So if you see the muscle in red, we've got the big lats there. So doing some sort of lat pull down exercise of some description. Shoulder extensors. So we've got posterior deltoid highlighted in red there. External rotators. Now, I guarantee you every single one of you have been given external rotation with a TheraBand at some point in your rehab. Scapular retractors. Again, I guarantee you've all been told to do some shoulder blade squeezes at some time in your rehab. And triceps. And triceps are another really important one for doing pressure lifts and being able to do transfers safely. The other type of exercise that's important is stretching or flexibility. So whether that's static, where you get a stretch and you hold that position for an extended period of time, or dynamic, where you're moving through range and warming up before starting exercise. Both are beneficial for different reasons. We're looking to maintain and improve muscle length, reduce the risk of injury, decreasing or reducing pain, maintaining mobility in joints, being able to do functional things like lean forward and put your shoes and socks on. Really tight hamstrings aren't going to let you get all the way forward. Shoulder range so that you can dry your back or wash your hair. Being able to turn and reach. One of the trickiest ones is kind of getting something from the back seat if you're in the car. Reaching for high shelves and maintaining your posture. So we've talked a little bit about the benefits of cardiovascular exercise for cardiometabolic health. So like I said, this is in terms of, so cardio meaning heart, metabolic meaning metabolism. That's heart disease, stroke, respiratory function, diabetes, obesity are all sort of lumped into this term of cardiometabolic health. So the main thing I wanted to get through to everyone is it's not too late to start exercising. So if we look at that graph on the picture, you can see that while lifetime exercises might have more benefit, a late start exercise quickly catch up. So, and they definitely end up way higher than no regular exercise. So the benefits are still there in terms of the mortality ratio, that a late exerciser is still miles ahead than a non-regular exerciser. And we've found that 25 minutes of daily moderate intensity exercise can reduce body mass index, so your weight, your body fat, and insulin resistance in participants with paraplegia when compared to inactive groups with spinal cord injury. Exercise also has a really big benefit for mental health. So it does have a chemical reaction in the body. So the way that, sorry, I live right on a main road and it's very noisy right now. So everyone's probably heard of the term endorphins, and that we get that endorphin release when we're exercising. So we also get improved self-confidence. If we're exercising outdoors, we get the benefit of the fresh air and sunshine. It can prevent cognitive decline. So exercise is what we call neuroprotective, where it helps to protect the brain and the nervous system from breakdown and degeneration. So it can protect from cognitive decline, helps to alleviate anxiety, increases brain power and alertness, productivity, decreases stress, and can increase relaxation. Again, I think that would determine on what type of exercise you chose. So we'll move on to talk a little bit about weight management. And weight in spinal cord injury is a bit of a tricky conversation, because a lot of the time what we tend to see is everyone drops quite a bit of weight immediately after their injury. So early on in rehab, we tend to see a lot of people drop a lot of weight while their body is almost in a bit of a fighting phase, where the metabolism's kicked up because we're trying to heal and recover. After that, the metabolism is significantly lower. So what we do see is that, what we do see is that the metabolism for someone with a spinal cord injury, even at rest, is significantly lower than the metabolism of someone without a spinal cord injury. So sitting side by side, even not moving, the resting energy that you're burning is less, which seems really unfair. We do have that increased risk of cardiovascular disease and type 2 diabetes that is associated with spinal cord injury, and doubly associated with increased weight. The psychological things: decreased quality of life, decreased functional independence, and increased carer needs. If anyone needs assistance for transfers, would understand that the increased weight might mean that your transfers would go from assistive 1 to assistive 2, bed mobility, things like that, or the need for bariatric equipment, which might increase the cost or need for new equipment. So when we are looking at weight management, we've got this little picture on the side. What we're looking for is, if you are aiming to maintain your weight, then you want a neutral energy balance. So we want the calories consumed on the left to be the same as the accumulative energies expended on the right of that scale. Now, as we've mentioned, the resting calories for someone with a spinal cord injury is lower than someone without a spinal cord injury. We've already mentioned that in terms of physical activity, our opportunities to participate in incidental activity are lower, especially if you're using a power mobility device, then that's lower. And then planned exercise is our other area where we expend energy. So we're just looking at that as a balance. If we are considering that our opportunity for activity is less and our resting calories is less, then the real take-home message is that it comes down to eating. So the real key for weight management is diet and nutrition. So I'm not going to harp on about that. That's not my area. I would recommend, if you do have weight management goals, to see a dietitian and to discuss how you can still get your nutritional needs met within your calorie allowance. Other considerations: obviously we are all individuals, so we've all got personal preferences in how we want to exercise. We don't all like going to gyms. That's okay. We all have different goals. We might be in rehab and wanting to learn particular skills, and we might really focus your program on the strength required for those skills. Or you might be further down the track and you're wanting to minimize your health risks. It's different for everyone, and that's okay. You've got different health backgrounds and injuries, and they all need to be considered when you're planning how you're going to participate in exercise. And like we mentioned, exercise will look different at different stages of your own life. So rehabilitation, whether it's sport and recreation or health and lifestyle management, it's important not to do the comparison game. Everyone is going to have their own fit for them, and that's okay. Things to consider before starting a new exercise program: recent health, whether there's been any significant changes to your health recently, impact of spinal cord injury. So we know there's things like thermoregulation, bowel and bladder function, the hand function, and pressure management. So they're really important to think about those things when we're setting up a program, that it's an appropriate environment, that we've considered how maybe getting in a pool or something might impact, or the positions we're putting you in might impact on bowel and bladder function. If we need any adaptive equipment for hand function, and cautious if you're transferring onto exercise equipment in terms of pressure management if you have impaired sensation. Pre-existing injuries or pain, exercise history, current level of fitness, and what suitable equipment you have available to you. My tips for getting started and sticking with a new exercise program: chat to a doctor or a health professional. Start gently and gradually. So we've read the exercise recommendations today. If you have not been exercising, I do not expect you to go and do them tomorrow. It is about gradually increasing the amount you do. and using those recommendations as a goal to achieve. If you can get there, that's brilliant. You're not going to get there tomorrow. Use a weekly activity planner, exercise planner. I find, for me anyway, get a workout buddy, way more accountable if I've got someone to meet there. Choose exercise that you enjoy. Set goals. I'm sure everyone's heard of SMART goals. So they're specific goals, they're measurable, they're attainable, they're realistic, and they've got a time frame. So you know what? Not doing any exercise this week, but next week, by the end of next week, I'm going to have done 5 minutes of exercise a day. It's a reasonable goal, it's achievable, and we've got a time frame. We're going to do it within a week. And use an activity or a habit tracker. So if you are someone who doesn't have a lot of internal motivation to get up and go, habit tracker apps are really common. There's lots of free ones out there. You can set a little reminder on them to tell you when it's time to exercise. And the other thing I'd say is talk to an exercise physiologist. There's a few helpful resources here. What I might actually do is just share these slides with Georgina so that you've got these links. These all have some really nice, easy to read information about the benefits of exercise and the recommendations. The bottom link, the SCIU, is a nice educational course that you can actually do. You can actually work through a few modules and really go through what the benefits are for you. And that's enough of me talking at you guys. I'm going to close that. If anyone's got any questions now, then by all means, feel free.
Thank you, Kirsty. That was amazing. That was really informative, and I'm sure everyone got a lot out of your presentation. So thank you so much.
My pleasure.
So I can see through in the chat box, we currently just have the responses to some of those questions you were asking midway through about people's confidence about exercise and how they rate themselves. So yeah, it's important, as you mentioned, about trying to get started and starting slowly, and forming a habit is such a big deal. And so if you're like, I was just reading a book called Atomic Habits, as recommended in a prior seminar, and it is quite amazing in terms of trying to make the habit attractive and easy, and also trying to link a habit with another habit to sort of help you continue with something that you want to do, like a goal of exercising. So we've got some questions here. What would you do for constant low blood pressure? Katrina Williams has asked that question.
Excellent. So with hypotension, so low blood pressure, it is safe to participate in exercise. One thing that is beneficial is strength training. So I would really recommend regular participation in a resistance training program. The other thing that you can be, that is quite useful is higher intensity exercise. But again, I would recommend that if you haven't regularly participated in exercise, to not start with that. That's something that I would work up to.
Atif Mehmet has asked for the links, but I will send an email out to everyone with all those slides and the links. When Kirsty's ready to share them with me, I'll send them out. We've got a question here. Stephanie, from Stephanie, asking you, Kirsty, are you taking on new clients at the moment? And
we sure are.
Okay.
And when I send through the slides, the contact information will come through with those. So otherwise, you can, if you Google STEPS Neurological Therapy, you'll find our contact details.
Karen's asked that she's currently seeing 2 physiotherapists. So she wants to know how she would know if she would need to see an exercise physiologist.
Well, I guess, Karen, that's a bit of a tricky question. It depends after what we've been through today, do you feel like your current programs are meeting your needs? So do you feel confident that you can meet those recommendations and that there's no barriers to doing that? And do you feel confident that you've got a balance in your program that's looking after your body and your health?
I don't know. I know the community physiotherapist is coming to my house, so to do with transfers and cars. So I don't think I really want to give that up. I think keys are their evidence is to say that 2 exercises twice a week is for half an hour, which I think is what you covered in your slide.
Yeah, for your strengthening, which is what KEYS tends to be, is a strength-based program.
Yes.
So it sounds to me like you've got a good, and like we went through earlier, like the role of the physio and that functional skills training is really important, but doesn't really count towards those exercise minutes that are helping to manage your health. So it sounds to me like the bit you're missing is your cardiovascular exercise in that huffing and puffing exercise for an extended period of time. So maybe you could speak with your healthcare team about how you could fit that into your week.
Yes, I wrote down huffing and puffing. That's
Excellent.
a good way of putting it.
Exactly. If you are huffing and puffing for a good amount of time, that's good for you.
No, it's been an excellent presentation, Kirsty, and I'll certainly keep STEPS in my agenda. I know Liz, I think, works there, doesn't she?
Yeah, Liz does work with us. Yeah.
So it's been excellent today. So thank you very much.
My pleasure.
Kirsty, we do have a question from Colin regarding quads, and he's had his spinal cord injury for 44 years. He has a table hand cycle exerciser, and he wants to know what is the reasonable time and frequency of exercising using his hand cycle.
Depending on, I'm going to give a very generalized answer here, Colin. It depends on where you're at right now. If you are already using it regularly, brilliant. I would be trying to get you up to those recommendations of doing 3 times a week, 20 to 30 minutes of cardiovascular exercise, which is what you're getting with that hand cycling. If you have not been doing it recently, then I would really recommend a very graded approach to be guided by your own body. If you're experiencing pain, then definitely stop. You don't want to go increasing shoulder pain or neck pain. I'm sorry, that's a very vague answer, but without knowing more detail into your exercise history, I don't think I can give any firmer advice.
No, over the last 2 years, I have not got into enough exercise, but I've also had shoulder problems with both shoulders from just overuse and old injuries, and I just don't want to go back to where I was.
No, and I think the other thing that's worth considering is that the exerciser is set up safe for you. So again, if it is something that you do and it exacerbates your pain, it might not be the right mode of exercise for you.
No, it doesn't hurt me. That's
okay.
That I found it's good.
Brilliant. If it doesn't hurt you, then, and you haven't been doing it regularly, my advice is to start a graded return to exercise. So start with, maybe, I don't know where your fitness level is at, maybe 5 minutes a day. And then in a week's time, bump that up to 8 minutes a day. And then go like that until you get up to your tolerating 20 minutes continuously.
Yeah, I generally do about 5 to 10 minutes when I can get innovated. But it's a case of I just don't want to get to the point of injuring my shoulders again because they've had so much problem.
Yeah. So I think a strengthening program that looks at those key muscles that we talked about earlier. And
half of those I don't have.
So did you say you were a C5?
C5, 6, yeah.
Yeah.
Complete.
So we'd definitely be looking at doing external rotation and strengthening that rotator cuff.
Yep.
and doing some scap squeezes, anything that helps to hold those shoulder blades in place. If you can do those strengthening exercises, that will help to minimize your risk of recurrence of shoulder pain. And then you can slowly build up your tolerance on the arm bike, and that will help to look after your heart and lung health.
Yeah, see, basically, we've got to do it ourselves because there's no physiotherapy available here. There's no programs like yours.
Yeah, it does make it a lot more challenging when you don't have access to services. The other thing is, if you need some,
and I go to him every couple of weeks.
Yeah, linking into services via telehealth can help for that, you know, setup of a program too, if that's useful for you.
Okay, thank you.
Following from pain, the issue of pain, Dennis Jones just has made a comment here, or a question I should say. He's found that increased exercise or activity has caused more neuropathic or nerve pain, and how can he overcome this?
Neuropathic pain's a tricky one to answer, and I've in years of working in spinal cord injury, I have found that it's very, very individual. Neuropathic pain that is exacerbated by exercise is often due to the increased circulation. The management of neuropathic pain is typically medical. There's no evidence to say that exercise can help with the management of neuropathic pain. We do see that with a lot of our clients, gradual exposure can help to build a tolerance. So again, I would be listening to your body and not pushing that pain so bad that it stays exacerbated. I would be trying to build a graded tolerance of a new exercise.
Yes, I think Brad Connolly has responded to Dennis's question. He's mentioned that massage and ROMS helps him. I'm thinking it's in relation to the pain. So I guess, would you recommend massage as well?
Again, individual. Some people find that massage and hands-on touch exacerbates their neuropathic pain. Some people find it beneficial. Musculoskeletal pain is often assisted by massage and range of movement exercises. I would definitely be talking about neuropathic pain management with your healthcare team because it really needs an individualized approach.
Great, yeah. Another question from Duke. You started off the session distinguishing physiotherapists and exercise physiologists. He wants to know where you fit in relation to occupational therapists and physiotherapists.
Yeah, so there's more of an overlap between physio and exercise physiology. OTs don't really have any background in exercise prescription. They will deal more with your equipment prescription. They do hand therapy, lots of work with sort of vocational rehab, so getting back into work and life roles, and setting up sort of accessibility for your home, any equipment that you might need in terms of bed and bathroom accessibility, increasing your independence in your day-to-day life. But they won't typically be a part of exercise prescription.
Yeah. It looks like you've got one more question here from the chat box from David McPherson, asking, would using a hand cycle in the reclining position be a better exercise for shoulders rather than using a table hand crank?
It all depends on the angle between your shoulder and where you're holding. So if you're you might see the hand cycles that people use on the road. They're in quite a reclined position and their arm cranks are in front of their chest. If it's a tabletop arm bike, then it's definitely better to be in more of an upright position. My setup for everything is that you should never have your hand above shoulder level. So when we looked at that shoulder anatomy picture earlier, and we saw that little hood of the shoulder blade coming over all those ligaments and tendons, if you have your hand up, they're going to be at higher risk of getting pinched. If you have your hand below shoulder level, you're at a much lower risk of injury. So if you've got your arm back on a table, my advice is to try to hold your arm cranks and try to make sure that they're not above your shoulder level.
Yep. I don't know if there's any more questions. If anyone's got a question.
I've got a question, please, Georgina.
Sure.
Can you hear me?
Yes.
Hi, Kirsty. Good to see you again.
Pleasure.
I do use STEPS, and I'm with TAC. So when I have to have any equipment, maybe exercise equipment or something, they're expecting probably a physiotherapist as well as an occupational therapist to give them a quote or give them some rationale why I should use it. Do you work in collaboration with the occupational therapist or do you submit to the TAC via STEPS to recommending what I need?
So it depends on the client and what their team looks like. If I'm seeing, I might work as part of a multidisciplinary team where we consider a client's overall needs and we make those recommendations as a team. Or if I'm just seeing a client for EP goals and I'm recommending equipment, then I'll just do that as a sole clinician.
Okay, because I've just been referred to by the spinal special people, you know, when I go and see them yearly, and they said to come and see you guys, but to see a physiotherapist. So will you collaborate together then to say, well, okay, this is what's been recommended by them, and I'll branch out to getting your assistance or something like that?
Yeah, so if you come, we sort of, you know, the referrals come in and we do our initial assessments and then we will determine where your goals sit most aligned to. So if the physios are like, you know, most of Duke's goals are all exercise related, an EP might be the better ones to prescribe the exercise. So yeah, it will depend on the individual, but yes, often you will get, you know, redirected to an exercise physiologist.
So the only question I was going to say, even if I wasn't with the TAC, so if we were to approach somebody like STEPS, do we come and see, is a first port of call to say hello to you or to somebody else?
No, first port of call would just be to ring and ask. We've got an intake administration worker, and as soon as you say that your goals, they will be able to tell you which discipline is best to help you. So again, if you rang up and you're like, I'm wanting to get some exercise equipment, they would book you in with one of our exercise physiologists.
Okay, gotcha.
Yeah.
Thank you.
Kirsty, there's one more comment here. I'm thinking I'll read this comment and might open it up to everyone. Like we'll we'll put everyone on the same screen. So this is from Rosemary. Thank you, Kirsty, for an excellent presentation. I go to Geelong Neuro Centre where I have an EP who individualises my program covering exactly what you were saying. This is great news for my confidence. I go twice a week and I'm feeling terrific. There are also physios, ATs, and a neuropediatrist.
Yeah.
Oh, podiatrist. Okay, sorry about that. Who all work together to my personal health, and I'm guessing STEPS will do the same. I recommend this centre for Geelong and close by residents from Rosemary.
Perfect. And I think that's similar to what, you know, we were saying with Karen earlier is if this presentation has helped you to cement that you know what you're doing and you feel confident, excellent, that's fantastic. If it's given you some ideas on where you might be able to improve your current routine, brilliant. It's going to be different for everyone, and where you go from here is going to be different for everyone, and that's okay.
Very good, excellent presentation. A lot of thank yous, Kirsty, with that. So I'm thinking we might remove the spotlight and you know, just have a chat amongst each other I'm sure, you know, a lot of people that have got questions would be interested in knowing what other people with lived experience are doing. I know your time is valuable, Kirsty. Appreciate your time. And if you've got time, you know, maybe you can stick around and sort of
Yeah,
join
happy
us
to stick around.
face to
I've
face.
got 10 minutes to stick around if anyone has any questions. It's always a pleasure to present to the SPIRE and AQA groups. So everyone who knows me knows I love to talk about spinal. So always happy to chat. And if anyone has any follow-up questions, feel free to send me an email as well. I will share my information with Georgina.
Great, thank you, Kirsty. I'm not sure if people realise that you started off at the Royal Talbot, is that right?
Yeah, back in 2009.
Okay, and then how did you progress from there to STEPS?
I did a very bold thing and I asked for a job. I had been working at Talbot for 6 years, and I was kind of after a new experience, and we had worked alongside, like we had often referred to STEPS for physio, and I knew that they didn't have an exercise physiologist. So I rang them and I said, is there any chance you want an exercise physiologist? And they were very, very gracious and offered me a job. And since then, we've now grown and we now have a team of 4 EPs at STEPS.
Wow.
Is exercise physiology a new thing, or how long has it been around?
No, it has been around it's been a recognised allied health profession for about 30 years. So it has been around for quite a while. It is just that our numbers are considerably lower than, you know, physiotherapy and occupational therapy. So it's not as widely known. But we have been around. I'm not sure anyone who's been through Talbot might know Wayne Dite. Wayne Dite's been working as an exercise physiologist at Austin for almost 30 years. So we have been around for a while. We're slowly stamping our place in the healthcare industry, and with more and more evidence coming out, like all the evidence we've presented and talked about today, it really is the biggest area that we know works. We know that exercise prevents health conditions. So as long as we can get everyone else on board, it's one of the most preventative things we can do.
Mm.
I'm very passionate about it, sorry.
With your presentation, because I know with smoking, if people smoke and they stop, apparently their health can increase quite like nearly back to normal. So it sounds like with exercise, if we start, well, if I start now, or, you know, I've started now, but, you know, it's like if people start, they can get to a really good level. It doesn't matter what age or whatever. So that's encouraging to know too.
Yeah, I think that's a really important take-home message, Karen, is that graph that we looked at, that, you know, late exercises, they still almost achieve the same health benefits of lifetime exercises. So better late than never.
Does anyone have any other questions for Kirsty?
So you were an EP, is that the acronym?
Yeah, that's the jargon, because exercise physiologist is too hard to say.
Oh so yeah, no, it's hard to spell. I think I did a typo in my chat.
We call ourselves EPs.
So you were an EP at Talbot?
I was, yes.
Yeah.
Yeah.
That was my question.
Yeah, I worked at Talbot for 6 years, and then now I've been working at STEPS for 6 years. But I don't plan on changing anytime soon.
Yeah. I was lucky you looked after me, Kirsty, while I was at Talbot.
Yes.
I remember you well.
Excellent. I hope and fondly.
Oh, definitely.
It sounds like with STEPS. Oh, sorry.
Sorry, I'm just trying to jump in there too.
Yeah, no, you're right. Brad, do you want to go?
Yeah, thanks. Thank you. Kirsty, thanks for a great presentation. It was really good. And everyone else putting it on. It's great to encourage exercise, I reckon. And I'm just wondering, STEPS in Melbourne, are they collaborating with Making Strides and Griffith University to do with this trial? with exercise that's happening through that group?
No, we don't have any affiliations with any universities. No.
Thank you.
We do try to keep our finger on the pulse as to what research is going on, and if people can participate, then we would encourage that. But we aren't completing any of the research at STEPS.
Yeah, and at STEPS, like I've been paralysed 24 years, and I got on quite early riding an FES bike, 22 years ago, and I still do it today. Yeah, every second day, and tilting and that, and it's great to see the exercise gyms opening up and giving opportunities to people, like specialised centres like this. I've been to the place in Geelong. I live in Ocean Grove. Just this multidisciplinary approach that the community, SCI communities having is good to see.
Yeah. It is a growing space, and I think that we do have NDIS to thank for that a little bit too, in that there's more facilities opening up. And as I'm sorry, I'm a bit bad with names, but earlier someone alluded to, it's quite difficult if you're in a rural, regional area. It's a lot more challenging if you don't have those facilities accessible to you.
Yeah. Yeah, thank you.
Pleasure.
Any final question for Kirsty? I'm not just mindful that Kirsty, you've got to get back to
go and
work.
do some work, yeah.
Yes.
Maybe just one. You spoke about all obviously the benefits, but how do you motivate some? I guess a little takeaway, because I've got a work colleague who I've asked several times to come train with me. He's got long hair. You might know him.
Start with N.
Keeps denying so maybe
Starting with N, ending with Z.
Going back to those, Josh, I think that's a really good question. And like I said at the start, it really is the crux of, I can and I do tell everyone all day, this is what I talk about all day, about why it's good for you, why you should do it. I can tell you what to do and why, but the only way people are going to do it, sorry, my dog's decided to join the party. The only way that people are going to do it is if it's important to them. So one, why? Come back to those questions we talked about at the start of the presentation. Why do you want to exercise? Are you trying to exercise because you want to live longer? You know that it's going to decrease your thing. Are you going to do it because you've got some anxiety and you know that it helps manage your mental health? Are you going to do it because you want to be able to do something better? Something in your life is hard, and you know if you do your exercises, like your transfers, if you do your strengthening exercises, they will get easier. It's a matter of what and why, and we can't put the importance onto it. That needs to come from the individual. So if they're doing it for enjoyment, what is it that they enjoy? One of the great things that's out there now is this the dance class. I've got so many clients that are participating in that, and do you know how much they enjoy it? And you know what? If that gets their heart pumping, that's cardiovascular exercise. So
It's been a blessing for me. I love it. I mean, it's been I don't know. I can't speak more highly of it in the time in my life when things are a bit pear-shaped, dancing, and Georgina would know that.
Yeah, I think you can be creative. I think there's a misunderstanding that exercise has to look like going to a gym. And for some people, I love going to a gym, but I'd say 80% of my clients do not want to go to a gym. So it's important to know what and why for each person. I think if we can map that, and then there's tools out there once we know that. So like I said, apps like habit trackers are really good. I'll often load those apps onto my clients' phones if they're not very good at, that self-initiation to get moving. That external alert from the app being like, now it's time to exercise, can help with that. But yeah, sorry, Josh, I'm not sure my answer was that helpful.
We'll see if I get a reply in my text. We'll wait.
It's like your buddy. So Naz, you're a buddy to Josh. Buddy,
Yeah.
what is it? There's buddy exercise, whatever it is. Take a
Yeah.
buddy.
Yeah. No, that's right. I think
I'm just on the
Josh.
speaking thing that
Wouldn't say no.
Oh, sorry, I thought that was a question. I just wanted to give them time, but you mentioned Josh being committed, to take those little steps. It's really important to a bit on what Karen was saying as well, having a buddy where you know what program you've got, you know what you need to do, 20 minutes a day, 3 times a week, whatever. Having a buddy makes you accountable and to each other. So that's really important. That's where you can get your motivation and feel like, you're there for the other person. That's really important. And on what Josh was saying too, Josh, you might want to speak to this further, but we've been talking about meeting somewhere with a bunch of people who are, like-minded, that want to be super fit like me, of course. No, I'm far from fit, but a place to meet where we can work on fitness, once or twice a week, somewhere central. I don't know where that would look like. There's a couple of track places, one in Heidelberg and one in Essendon. AQA's in Fairfield, so right near Heidelberg. But if people are interested, and maybe in the email that Georgina sends out with the slide, we can ask that question. If anyone's interested in meeting once a week or twice a week, we'll try to find a venue and get something happening.
And
there's lots of the outdoor exercise parks popping up. That I know that there's a huge one in Bentley being built, and it's even got an arm bike in it, which excited me. I'm easily excited. But go down to one of those parks with a couple of TheraBands thrown under your chair, and you've got enough to do a whole workout program.
Yeah. And that's the thing, it's really individualised, because I know when me and Nars would go, I'd be in the track chair, but he'd be doing laps in his day chair. So it's all highly individual, and as you sort of alluded to there, just really tailoring those programs, but we can do it as a group. Yeah. Yeah,
even just doing your own thing, but in the same space as other people is a good start for getting started. And I know that my sister lives in Queensland and I live here, but we follow each other on our Apple Watches. And so I get an alert, Tamsin's done a workout. And next thing that prompts me that I better go and do a workout, because otherwise she's going to beat me. So
it's being competitive.
Yeah, everyone. I mean, that motivates me. I've got probably a bit too much of a competitive spirit, but everyone's motivations are different. So I think find out what works for you in terms of whether it's accountability to others, whether it's a competition, and use that as a tool.
Or even the copy post training.
Yes, I was going to say I used to do that with some friends. We'd always go to the beach and have a coffee halfway. So you get there, coffee, and then get back. So as long as we had a coffee and it was a social thing too, and you're near the beach, the environment, and I really noticed that my fitness at that time improved, but it was a whole, lot of factors. Yeah.
Kirsty, I got a last minute question for you. Do you, I play a specific sport, which is para badminton. Do you have, can I see you about specific exercises that are relative to my sport?
My experience with that would be, if you were asking badminton specific skills, I would be the wrong person to ask. I've never played a game of badminton in my life. But in terms of, I do understand the movement patterns and injury management and prevention, in terms of especially those high force rotational overhead positions, which are quite high risk for shoulder injuries, then yes, I could give you an injury management program. Yeah, so it'd be a little bit, again, I feel like every answer that I give here, I start with, it depends.
True, well, that's fair enough. But I was thinking more along the biomechanics side of it, really.
Yeah, so in terms of the optimizing your shoulder function and biomechanics, yes.
Sounds like, Duke, you'll be making a call to STEPS in the next couple of days.
Well, what do you mean next couple of days? Tomorrow? What do you mean?
Oh, tomorrow. Okay.
I better run, everyone. I do have to get to another client. It's been an absolute pleasure to talk to you all. And I will share right now, Georgina, I'll share that information with you straight away.